My phone is blowing up a little bit with updates from the Capitol. So I'm hoping you guys can hear me and all is well. We have a chat here if anybody wants to chime in and tell me, okay, good, we're good. So I'm going to start rolling. Okay, y'all, I have to tell you, it has been one of the busiest sessions I've ever had for medical freedom, which every session it can start out kind of slow, but we've been nonstop from day one, but we've been waiting for things to get moving, and now things are finally moving. I have to tell you, last call, I felt like I was losing a little bit of help, but I've got a lot of great updates for you. So I'm going to roll into those. And if this is your first call, thank you so much for joining. I am Jackie Schlegel, the Executive Director of Texans for Medical Freedom. And we are in the middle of a legislative session, and we are working tirelessly not only on medical freedom, but on this broader agenda to make America healthy again and make Texas healthy. And there are so many bills, and I'm going to give you a rundown on just a few of them. Some that have hearings, some that have already made it out of their hearings, and some that we are waiting for. So I'm going to go through the bullet points. So if you have a pen and paper, this is your time to take some notes so you can get the update on where we are on things. Okay, the first one, SB 754. This is an informed consent bill. We are still waiting for this bill to get a hearing in the Senate. Um, and so if you want to reach out to Senator Brian Hughes and ask for a hearing, the kind of flip side of that is we have another bill, Senate Bill 95, that is an informed consent bill. That is already moving. That has passed the Senate and that is in the House. And so we want this hearing for Senate Bill 754, but we do have another avenue to advance this legislative priority if we don't get Senate Bill 754 by Mays Middleton moving. So that's the update on that bill. HB 1586 is this is by Representative Lacey Hull. This is a great bill that we have filed numerous times. And actually, as I was hopping on to this call, I was getting an update from some of my friends inside the building. The lobby is really pushing hard right now, the pediatricians against this bill, which really doesn't make sense because the only thing this bill does is allow parents to print out their vaccine exemption form. Right now, we have a process where you have to go to a state website, you have to request the form, they mail it to you, you get it notarized. It costs taxpayer money to do this. And it takes time and kids miss school. A parent already has the right in the state of Texas to opt out and to utilize this exemption form. We're just asking for it to be easily accessible on a website. And some of the lobbyists and pediatricians are, of course, showing up and saying this is a bill that affects immunocompromised individuals. As the parent of two of those kids, I can assure you this is not what that bill does. And so we are going to need you to register public testimony on Monday. We don't necessarily need a lot of people to show up and testify. That drags out the process in the committee hearings. If we have one or two good testimonies, we're pretty sure we know where the vote is on this. Committee just got to have it, but we do need you to register that testimony. And so we'll make sure that everybody gets that link in an email so that you can do that. SB 407. This is Senator Mays Middleton, and this is the religious exemptions bill that would ensure that healthcare workers are able to use a religious and philosophical vaccine exemption at their place of employment. Right now, the way the code is written is a hospital or a facility may accept an exemption, but they don't have to. That removes that. And that means that you would have these facilities would in essence have to accept a vaccine exemption. They cannot just a blanket denial, which is what they've been doing. This is really good legislation. This was placed on the intent calendar this week. That means it will be on the Senate floor next week. And I already have a House sponsor lined up. And that's very important for a bill like this that when it gets over to the House, we have somebody to pick it up and carry it and move it along in the process. So we're very excited about Senate Bill 407. I would just tell you on a side note here, the hearings that we are having in the Capitol, they're really unlike any conversation we've had in the last 10 years in that building. Our message is really resonating. There hasn't been a lot of pushback. I'm actually a little surprised to see the pushback on 1586 because, again, we have bills that are informed consent where we are asking the doctors to be required to give full disclosures of the vaccines. And those bills are passing through the Senate, and the lobbyists are, kind of freaking out about a bill that just allows you to print out an exemption form. It's very, very interesting. But overall, it's been a really, really good session, and there hasn't been a lot of pushback on some of these bills. But the legislative process can be very, very slow. And so we're working really hard all day in that building to try to get things moving along and keep them moving along because we only have about 40 days left in this legislative session. SB 269, this is the Vaccine Adverse Reactions Reporting Bill by Senator Perry. That was voted out of committee unanimously. And so that's on the uncontested calendar. That's going to be coming over to the House soon. Also been working on that House sponsor. So we're really, really excited about that bill. Senate Bill 386, which is about jurisdiction for the international health organizations. That is also in Senator Brian Hughes's committee, State Affairs, and it has not been given a hearing. And so when you call Senator Brian Hughes, you can ask him if he would hear SB 386 by Senator Schwartner related to the jurisdiction of the international health organizations. And our follow-up bill will have all of this information and links for you. The next bill is HB 4076. This is a bill that I'm so passionate about, and we get so many phone calls from individuals who need an organ donation. They need to be put on the transplant list. And they're calling us because they're saying, we can't get on the list if we're not vaccinated with everything. And sometimes that's a lot of vaccines. And sometimes for children, it's a vaccine against a sexually transmitted disease, right? And the parents are saying, we don't want our 9-year-old daughter to have this vaccine. It's completely irrelevant to her transplant. We can't help those families right now. Right now, if they don't get up to date with every single vaccine, they cannot be on the organ donation list, the recipient list. And it's a heartbreaking position that these parents and individuals find themselves in. So 4076 would require it would remove that. You would no longer be able to decline organ donation or organ transplant based solely on vaccination status. So this bill is being carried by Chairman Jeff Leach. And I'm just so thankful for him for stepping up and filing this bill. And that has a hearing on Monday in public health. So again, that is a bill we need you to register public comment on. So the next one, HB 4381. This is the Medical Freedom Education Act. This would require school districts to notify parents of their medical freedom rights, their right to opt out of school-based health clinics, their right to opt out of vaccination, their right to opt out of curriculum, health curriculum that the parents do not align with. It's informed consent with knowing psychological assessments. Anything related to basically your child's health at public school, this bill would ensure you are notified and you have full informed consent for everything for your child. This has not been given a hearing yet. However, we have a vehicle, another bill in the House that we are going to amend. And the amendment is acceptable to the author, which means it has a much higher likelihood of passing when the author accepts the amendment. So we've been working tirelessly to make sure we have the votes for that and to make sure that the bill author and the author amendment are in alignment and in agreement. This would be a huge win for medical freedom. But we're still going to continue to promote 4381 by Hefner, and we're going to request a hearing for it. But just know we are working on this alternative option to get this to the finish line and signed into law. It will be a huge, huge win for parental rights and medical freedom. Um, HB 4535. I love this bill. It's been a little challenging though, because this is a COVID vaccine transparency bill. And this basically says, the providers, whoever's administering the vaccine, needs to give full disclosure on the nature of this vaccine and then how to report a reaction. But even throughout the week, as we're preparing for this bill, and I'm preparing my bill author to lay out this bill, the recommendations could be changing for the vaccine. I don't know if you know this or not, but like the World Health Organization does not recommend the COVID vaccine for children. Yet here in the United States, it's on the childhood vaccination schedule. So as we're preparing for this bill, there's a lot being done on the federal level that could impact, whether this bill's even necessary or not. Of course, we're going to move forward just like it is. We need you to register public comment. Again, we'll give you that link. But 4535, the COVID vaccine transparency bill by Representative John McQueenie, is being heard Monday in public health. So we're very, very excited about that. My last bill, provisional enrollment. You guys may have remembered this bill. We've talked about it if you've been on these phone calls. This bill was actually written to go to public education as a backup bill for 1586. It got sent to public health. And so I actually sat down with the chair a couple days ago. He was going to hear this bill. And we kindly asked of, hey, because we have 1586, that's the bill we want to move forward. 4587 was a backup bill that was supposed to go to Education Committee and would have been like another, way. But we don't need two bills really kind of accomplishing the same goals in the same committee being heard. And so that is most likely not going to be heard. And the chair honored our request and is bringing up 1586. So just as an FYI for anybody who's making phone calls or, promoting and saying, hey, we're Texans for medical freedom, legislative priorities. We are the ones who asked him not to move that bill because we have 1586. So, guys, we have a lot of great things going on in the Capitol right now. We have Senate Bill 95 that has crossed over from the House, that is the Bob Hall Informed Consent Bill that has passed out of the Senate and it's in the House. We got a House sponsor this week, and we got a commitment from somebody who can move the bill and get it to the floor and get this signed into law. So, a lot of really good, exciting updates, and a lot of action is going to need to be taken. We will send you an email follow up, and it will give you the action alerts and the points of contact. And I know many of you on this call will want to call or email the Public Health Committee, and that's great. When you push this out to your broader network, what we're really going for is that public comment. There's an actual form where you can register public comment, and it's actually included in the report. So it is public. It will be on a website for everybody to see, but it's a really good way to show support if you can't be in Austin. If you happen to be near the Capitol on Monday, swing by, register there in support of the bill. You do not have to testify, but you can register support. We would definitely very much appreciate that. So say a prayer these last few weeks that, again, we've been in that building since January with these legislative priorities and working tirelessly with the legislators, and things have felt a little slow, but they're really picking up. Things are starting to move. Leadership in the House has been very responsive, communicating and ensuring that our bills continue to move forward. But we're there in that building every single day to make sure that we get these medical freedom priorities to the finish line. So, with that, thank you guys so much for joining, and we will send you a follow-up email shortly. And, wish us luck on Monday. All right, thanks, guys.